Hi, myself Gowthami from Food and Nutrition Department. Today we are going to see about hidden facts about vitamin D and obesity. So there is a relationship between vitamin D and obesity. Till date, so many of them didn't know about these things. This is facts which is hidden behind this obesity and vitamin D. That only we are going to see now. So first thing, I am going to explain about what is vitamin D and what is obesity. Then only finally we are going to see about the interrelationship between obesity and vitamin D. So first thing is vitamin D. It is a fat soluble vitamin that we all know that, and it's also called as calciferol. And few foods it contain vitamin D, and we can also obtain vitamin D from sunlight. The main food sources we can obtain vitamin D from sunlight only. And next, our body produces vitamin D on its own. In kidney, the vitamin D it is converted to its active form in kidney itself. So, the another important role of vitamin D is it is helpful for maintaining the calcium and mineral metabolism, and also helpful for bone growth and maintenance. And most cells in the body also have been found to have receptors for vitamin D, and therefore now seen as an important nutrient in preventing many chronic diseases. So vitamin D is a only nutrient which is very important for all the age groups, and it is also preventing many diseases. And the vitamin D, how it is converting into the active form. This is a picture it is given here. It is shown cholesterol from diet, and sunlight converts 7-dehydrocholesterol to pre-vitamin D3. We are obtaining from two sources. One is from plant, that is food sources, and then from sunlight. And we are getting like 7-dehydrocholesterol in the skin, and then it is converted to cholecalciferol pre-vitamin D3. Then it is converts into 25-hydroxy vitamin D. The liver, which is helpful for converts the pre-vitamin D to 25-hydroxy vitamin D, which appears in the circulation. And after that, it is converted to 125-dihydroxy vitamin D in active form for this kidney, which is very helpful for this conversion. So the active form only. So here in this slide, we are going to see about the conversion of vitamin D to the active form. How our vitamin D is getting activated in our body. So from food sources and from sunlight, we are getting our vitamin D, and in the skin it is converted as 7-dehydrocholesterol in the skin, and it is converted to cholecalciferol, that is pre-vitamin D3, and it is converted to 25-hydroxy vitamin D with the help of liver. Okay, in the liver it is converts pre-vitamin D to 25-hydroxy vitamin D, which appears in the circulation, and from there it is converted to 125-dihydroxy vitamin D in active form. So for this activation, the kidney and other tissues, which is helpful for the active form of vitamin, to get the active form of vitamin D3, the kidney and other tissues are helping. And metabolism, same like before I said, pre-vitamin D and from the food sources, vitamin D is converted to the liver and then kidney, and in kidney it is helpful for maintain calcium economy, and then in liver it prevent or treat viral respiratory diseases, cancer, osteoporosis and heart diseases, and multiple sclerosis, diabetes and hypertension. And regulation, how that is vitamin D, another functions of vitamin D is in kidney, it is maintaining the calcium homeostasis and muscle health, bone health and blood pressure regulation, cardiovascular health and neurodevelopment and immunomodulation. In monocytes and macrophages, 125-hydroxy vitamin D is helpful for immunomodulation, prevention of autoimmune diseases, control of invading pathogens, and in prostate gland, breast, colon, lung and keratinocytes, 125-hydroxy vitamin D, which is helpful for regulation of cell growth and differentiation. Next is what causes vitamin D deficiency. So inadequate sunscreen, that is use of sunscreen, and melanin pigment which is present in human body, and high latitude and winter season, we are not able to get enough sunlight in winter season, so that vitamin D deficiency directly affect the human body, and these are all the diseases we can get due to inadequate vitamin D. liver failure, renal failure, obesity, and nowadays obesity is more common among every young generations. So that has been going to be discussed in future slides. And causes. So main causes, there are 4 main causes of vitamin D deficiency. Already I said the skin, that is skin type. Darker skin people are not able to get enough vitamin D due to sunscreen, that is use of sunscreen, and they are not able to absorb the ultraviolet UV rays from the sun. Their absorbing sunlight is essential for the skin to produce vitamin D. So darker skin people are not able to get adequate vitamin D from the sun. And sunscreen lotions. Use of sunscreen lotions also preventing vitamin D absorption. And then geographical location. People those who are live in northern latitudes or areas of high polluted and working night shifts and are homebound should aim to consume vitamin D food sources whenever possible. If they are not able to take vitamin D foods from sources, that is, or else they have to take supplements. So because they are not able getting enough sunlight, they are not exposed to sunlight, so that they are they are prone to diseases. Next, breastfeeding. So infants who exclusively breastfeed need a vitamin D supplement, especially if they have darker skin, as I said before. And sources of vitamin D. The main source is vitamin D. We can get vitamin D from sunlight. Okay, so getting sufficient sunlight is the best way to help the body produce enough vitamin D. And from food sources, there are few food sources here mentioned: fatty fish, egg yolks, cheese, beef liver, mushrooms, fortified milk, and fortified cereals and juices. We can get vitamin D from these few food sources. And there are 2 types of vitamin D, 2 major types. Okay, 2 major types of vitamin D are there. One is ergocalciferol and another one is cholecalciferol. So vitamin D2, which is synthesized by plants, and vitamin D3 is made in large quantities in the skin. When sunlight strikes bare skin in foods, it is ingested from animal sources. So these 2 are major type of vitamin D. One is from plant sources and another one is from we can get from animal sources. So these are all the 5 types of vitamin D: D1, D2, D3, D4 and D5. So in vitamin D1 it is named as ergocalciferol with lumisterol, and vitamin D2 ergocalciferol derived from ergosterol, and vitamin D3 cholecalciferol derived from 7-dehydrocholesterol in the skin, and vitamin D4 is called as 22-dehydroergocalciferol, and vitamin D5 is called as cetocalciferol derived from 7-dehydrocholesterol. So vitamin D and chronic diseases. If you are deficient, if you are not having adequate vitamin D, means what are the diseases will be occur to the human body. So the first one is regulating calcium and phosphate metabolism for bone health, and autoimmune diseases and atopic dermatitis and cardiovascular diseases, chronic respiratory diseases and Crohn's disease, diabetes, kidney disease, osteoarthritis, periodontal disease and rheumatoid arthritis, skin disorders and some cancers also, then infectious diseases and schizophrenia. So these are all the diseases will occur. And then RDA, recommended dietary allowances for certain age groups. So age 0 to 12 months, they have to, for male 400 IU is needed, for female 400 IU is needed, that is 10 mcg, and for 1 to 13 years 600 IU and 600 IU for female, and 40 to 18 years 600 IU and 600 IU for both female and male, it's same. For pregnancy also 600 and also lactation 600, and 19 to 50 it's also called 600 IU only, and next 51 to 70 years 600 IU, and 70 years and above 800 IU. So after that is 70 years they need more amount of vitamin D in their diet. So let us see about calcium versus obesity. So why there is a relationship between calcium and obesity? So there is a relationship. Why means low serum calcium, that is intake, which increases the serum calcitriol levels and which stimulate the flow of calcium from adipocytes, which vitamin D membrane receptors, and then it increases the intracellular calcium levels, and it increases the activity of fatty acid synthase Then what happens means it inhibits the expression of hormone sensitive lipids. Then it promoting lipogenesis and inhibiting lipolysis. So there is a form we can able to identify lipogenesis and lipolysis. Genesis means it is formation, lysis means it is breakdown. So what is happening here? Genesis is more, that is promoting the genesis, and lysis is inhibiting. So lysis, breakdown of lipids is here inhibiting. So that what is happening? It resulting in the accumulation of body fat. So high amount of body fat is being accumulated due to decreased intake of calcium. And then calcitriol, which inhibit the expression of uncoupling protein also, then that is uncoupling protein which is involved in the regulation of metabolism, diet induced thermogenesis and body weight control. The classic nuclear vitamin D receptors in adipocytes thereby increasing the energy efficiency. So lack of calcium also increasing the increasing the lipids in our body. So food sources, these are all the food sources. So given by NIH government. So cod liver and swordfish, salmon, tuna fish, orange juice, milk, yogurt, margarine, and then sardines, liver. Maximum we can get vitamin D from animal sources. And next thing, these are the picture of that food sources. So broccoli, squash, papaya, fish, mango. So all these things, all these food sources we can get vitamin D. And recommendations. What are the vitamin D intake recommendations of glucocorticoids, antifungal, ketoresinol and medications for heights? Be given at least 2 to 3 times more vitamin D supplementation according to their age group. And next thing is for infants, 1000 IU is needed for up to 6 months and 1500 IU is needed for after 6 months to 1 year. At least 2500 for children aged 1 to 3 years, and next 3000 IU for children aged 4 to 8 years, and 4000 IU for everyone over 8 years. And higher level of, that is more than 2000 IU for children 0 to 1 year, and 4000 IU for children 1 to 18 year, and 10,000 IU for children and adult more than 19 years, and older may be needed to correct vitamin D deficiency. So all these recommendations given. And next we are going to see about obesity. So obesity is a more common problem worldwide. Every age group, every children are facing and these problems. So what and all will happen if you are obese? So you will be get type 2 diabetes and hyperlipidemia and obstructive sleep apnea, and next heart diseases and hypertension and osteoarthritis and other diseases also. Okay. So present status. So what is the present status of obesity? So in India, India is a home to second highest number of young people who have excess weight. Our India is placed second, who is having obese in second, that is excess weight people we are having more. By 2025, you think that 2025 India will have over 17 million obese children are concerned according to the study. Okay, so more than 17 million obese children will be having in future. And then in the world, there are nearly 108 million children and more than 600 million adults with BMI exceeding 30. So BMI exceeding 30 is nothing but they are prone to obese. Next, China, 15.3 million children with obesity, and India 14.4 million. It is very bad to hear, but we have to accept this. And among others, the US topped the list with 79.4 million people with obesity, and China came second with 57.3 million people with obese. So obesity, what does mean by obesity? So many of them will know about this obesity, but few points I just wanted to tell here. So obesity is nothing but excess amount of fat accumulation in the body. It is called as obesity. And types, there are, we can also that is 4 classes here they given. One is overweight, class 1 obesity, class 2 obesity, and class 3. If the human being having 25.0 to 29.9 BMI means they are overweight, and 30.0 to 34.9 considered as class 1 obesity, and 35.0 to 39.9 is considered as class 2, and class 3 is greater than 40. And next one is What causes obesity? So there are different types of causes are there. So one is genetics, and another one is overeating, and physical activity, lack of physical activity. It's also major cause of causing obese. And medications which we are taking for some other diseases, it is also causes obesity. And environment, and hypothyroidism, and high calorie foods which we are taking. So these are all the foods. So which is yes and no. For obese peoples, they have to take foods like this, like fruits, vegetables and whole grains. And they should not take fast foods, sweets and sausage and bacon. So this is a good explanation for the do's and don'ts. And now we are going to see about what is vitamin D associated obesity. Okay, so there is an association between vitamin D and obesity. So obesity is defined as a BMI, which is the human body is having higher BMI. BMI is called as obese, and BMI is greater than 30. It has been associated with low serum vitamin D levels. You have to check your weight first, and then you have to check your vitamin D levels. If you are having low vitamin D, means it is the main cause of obese. If you are obese, means you have to check your vitamin D, then you can go for other treatment. Okay. So some studies have shown that obesity has been associated with decreased sunlight exposure also. If you are not exposing to sunlight at least for 10 minutes per day, you will be becoming obese. Okay, so there is a metabolism, there is a reason is there. We will be discussing in future slides. And older people with obese are at risk for many diseases like CHD, hypertension, metabolic syndrome, osteoarthritis and diabetes mellitus. And next thing is vitamin D deficiency contributes to many countries, that is many chronic metabolic and endocrine diseases, and it is also associated with low calcium serum levels, especially abdominal obesity. So those who are having abdominal obesity, the fat accumulation in the abdomen, you can go and check your vitamin D and serum levels, that is calcium levels in your body, will be getting a good result. And then in obesity, vitamin D affects insulin secretion, tissue sensitivity to insulin and systematic inflammation. And next, vitamin D metabolism and 25-hydroxy vitamin D synthase are impaired due to development of hepatic steatosis and caused as a result of obesity. And the metabolism of vitamin D due to influence of adipose tissue plays a pathogenic role in obesity. So you can see here, due to lack of sunlight exposure, outdoor physical activity, and then excess body fluid distribution and impaired vitamin D metabolism and decreased vitamin D sequestration and impaired vitamin D releases other mechanisms. Due to all these reasons and also vitamin D deficiency, which leads to cause obesity. Okay, so vitamin D versus obese. So vitamin D is a fat soluble. So it is a fat soluble. It is needed to our body to soluble the fat. Okay, so if the fat present in our body, the fat soluble vitamins, which is what it is doing, it is soluble the fat and it helps to excrete our fat through feces. Okay, so what happens if you are not having vitamin D means it will be increase your fat accumulation in your body. Okay, so vitamin D is a fat soluble, it is sequestered and stored in adipocytes. Okay, so that reduces its bioavailability and triggers the hypothalamus to generate a cascade of reactions that leads to increased feeling of hunger and decreased energy expenditure to compensate for the lack of vitamin. Okay, then among these reactions, parathyroid hormones also play an important role in this, and vitamin D deficiency may be related to lack of sun exposure in obese individuals, so they already said, and they become no more sedentary worker and remain more sheltered from the sun. And then the cause and effect association between two pathologies is not yet clear. So what they are recommending, increased consumption of foods that have been fortified with vitamin D for obese with low vitamin D levels. For obese human beings, if you are having low vitamin D, you have to take vitamin D supplements, or else you have to take more vitamin D rich foods and sensible sunlight exposure. So it is better when starting your supplements, before that you can try a limit, that is a sensible sunlight exposure. And then vitamin D supplementation during the winter, and in those who use sunblock during the summer. So during winter season you can take supplements, and you can also block, that is sunscreen lotions and all you should avoid during summers. And access vitamin D levels in the blood at annual checkups. You can also go for a regular checkups. These are all the research evidences I have presented here. And next, this is also research evidences you can also see in net. And background status, vitamin D status. Low serum vitamin D may be associated with the risk factors of several chronic diseases and prevalence rate of vitamin D and obesity. Vitamin D associated obesity is more among young women nowadays. Okay, and then so clinical consequences of lower hydroxy vitamin D is low plasma level of vitamin D. What it will do usually leads to impaired calcium absorption in the bowel and lower the plasma calcium level, which consequently lead to enhance the bone turnover and impair the bone mineral density too. If you are having not enough vitamin D and if you are having obesity, please check your calcium status also and your BMD status. And high prevalence of obesity, that is vitamin D deficiency in obese subjects, is well documented findings. Most that is probably the volumetric dilution into the greater volumes of fat, serum, liver and muscles, even though other mechanisms could not completely that is excluded, as they may contribute concurrently. That's one of the study. And causes of low vitamin D in obese patients. Why low vitamin D specifically for obese? So here, even though obese and lean subjects having same vitamin D amount, in overweight people the vitamin D is distributed into the large volume, making serum concentration lower. This is please note down these points. This volumetric dilution of vitamin D is the most probable mechanism of the inverse relationship between vitamin D serum levels and BMI. So this also I took from study. So in more studies is required about this obesity and vitamin D. Needed more studies. And findings of my research is vitamin D is a fat soluble, we already know that, and all of these compartments are increased in volume in obesity, so that lower vitamin D likely reflect a volumetric dilution which affects the whole body stores of vitamin D may be adequate. And despite low vitamin D status, obese adults don't have higher bone turnover, low bone mineral density. And next, patients who are undergoing bariatric surgery do have bone loss. Surely they have bone loss, and ensuring vitamin D sufficiency in these patients may help to attenuate bone loss. And next things. So obese subjects had significantly low basal 25-hydroxy vitamin D concentration and higher PTH hormones concentration. Evaluation of vitamin D and concentration 24 hours after whole body irradiation showed that incremental increase of vitamin D was 57% lower in obese than in non-obese subjects. This is also one of the study. So we need to assess our body weight first. We have to check our regular body weight and vitamin D status. After that you go for a treatment for obese. If you are checking your BMI is increased, as soon as you are going for the treatments. So first you check your vitamin D status and bone mineral density status, then you go for your treatment. That will be giving a good result for you all. Thank you.